Thank you, Mr. Chairman. Chairman Isaacson, Ranking Member Blumenthal, and members of the committee, thank you for holding this hearing today. I appreciate the opportunity to speak briefly with you about my legislation, S717, the Community Provider Readiness Recognition Act. Mr. Chairman, as you know, the suicide rate among our military service members and veterans is not just a tragedy, it is a crisis. Last year, we lost 443 service members to suicide. Last week, the Department of Defense reported we have seen more than 200 military suicides in the first half of this year. We were all painfully aware of the statistic that 22 veterans every day take their own lives. In Indiana, we've lost too many Hoosier veterans to this scourge. I'm sure each member of this committee can say the same about your home state. Despite the time and effort we, DOD, and VA have put into combating military and veteran suicide, these numbers and the stories of each of these preventable deaths tell us how much more work we have to do. The key challenge we must overcome is tackling this problem with a clear-eyed understanding of how stigma, provider shortages, and budget constraints impact when and how veterans and service members seek care. I've worked over the past 3 years to advance common sense bipartisan legislation to meet that challenge. We took an important step forward last year with the Jacob Sexton Military Suicide Prevention Act, which was part of the National Defense Authorization last year. This year, I'm working with several Republican colleagues to advance the Service Member and Veterans Mental Health Care Package, 3 bills aimed at improving the accessibility and quality of mental health care for vets, service members, and their families. I'm here today to talk about one of those care package bills that is on the agenda, S717. I've been working with my colleague, Senator Ernst, whose experience and insight as a veteran and as an officer in the Iowa Army National Guard has been indispensable. This bill creates a special designation for private sector community mental health providers who demonstrate a strong knowledge of military culture and evidence-based therapies for mental health issues common to veterans and service members. It creates a regularly updated online registry so vets and service members can search for these special providers. Due to an increasing demand for mental health services, combined with DOD and VA provider use shortages, use of community providers by service members and veterans has increased dramatically. If we know veterans and service members are accessing care through private community providers, we owe it to them to do our best to improve the quality of care they receive in those settings and to provide resources to help them select providers who understand their unique challenges and how best to treat them. That's the goal of S717. Multiple internal and independent reviews of DOD and VA purchase care networks have identified the need to improve military cultural competency and the use of DOD-VA clinical practice guidelines and evidence-based therapies to enhance the quality of care service members and vets receive from community providers. I have a few examples with me here today. DOD's 2010 Suicide Prevention Task Force report, the Institute of Medicine's 2014 assessment of PTSD treatment for military and veteran populations, and RAND's 2014 report entitled Ready to Serve. We know more and more veterans each year are going to be seeking care from non-VA providers. We need to be sure as many of those providers as possible are trained to provide high-quality care. And we need to give vets tools to help them make decisions on where to seek care, whether or not they're using their VA benefits. Both DOD and VA are working to push out trainings in military culture and evidence-based therapies for providers, but it will come as no surprise to know the uptake rates on those trainings needs to improve. We need to give providers better incentives to participate. Many of the trainings are already free. Many already grant continuing medical education credit. We could require the training. We could tell providers they can't be in DOD and VA purchase care networks unless they complete it. But imposing those kinds of mandatory requirements can backfire at a time when our vets and service members desperately need more options. S717 gives providers an incentive to voluntarily access military and veteran-specific training and receive a military veteran-friendly designation if they fulfill the requirements. The STAR program, which was begun in Indiana, has now expanded to 7 states, including the home states of a number of members of this committee. Mr. Chairman, as you know, Georgia is one of those states, and it's an extraordinary program. The DoD provisions of this legislation were included in the FY16 NDAA conference report under Section 717 with unanimous bipartisan support. Can I have an additional 30 seconds? Thank you, sir. Assuming we keep intact our 53-year record of passing the NDAA, this legislation will become law by year's end, but only for military personnel and their families, not for veterans. The NDAA deals only with this program as it would impact DoD, service members, and military families. It does not address veterans or the Department of Veterans Affairs. That's why I'm here today, asking to work with all of you to ensure the services established through this legislation are available not only to current military personnel, but also to the veterans that we care for so much. Mr. Chairman, thank you for your time.